Oh, I absolutely adore this story. Thank you so much for sharing it with me. Now, can you do me a favor? Please remember to hit that like button and subscribe if you haven't yet. Tall and impeccably dressed, he navigates the halls of St. Hillman Memorial Hospital like a general surveying his domain. His surgical skills are flawless, his confidence but those who work beneath him, particularly nurses, especially women, and especially women of color, experiences quiet storms of arrogance, bias, and subtle cruelty. Well, after a 3-hour investigation, Dr. Langford is summoned to the executive conference room where he finds not just the hospital's legal team, but also the patient from room 304, now revealed as a prominent civil rights attorney and judge. In conclusion, this story is a powerful testament to the enduring strength of those who face adversity with grace and integrity. It's a reminder that true power lies not in position or privilege, but in character and compassion. The story challenges us to examine our own biases and to recognize that change can come from the most unexpected places. If you enjoyed this story, please don't forget to like it and share your thoughts in the comments. Your feedback is invaluable and inspires us to continue delivering quality content. Thanks for joining me today, and I look forward to bringing you more thought-provoking stories in the future. Until next time, stay curious, stay engaged, and keep exploring the world of literature with us. He explains that he went undercover to expose any potential discrimination within the hospital, and he has gathered substantial evidence against Dr. including the offensive language used towards Tiana. Judge McCarthy, representing the hospital's largest benefactor, delivers the news that Dr. Langford's contract will not be renewed. He is stripped of his position and, despite the injustice, Tiana stays composed, demonstrating the true meaning of professionalism. Enter Tiana Brooks, a nurse who is intelligent, professional, and warm. Despite the societal biases that underestimate her, she remains resolute, her spirit unbroken. Is it a highly skilled surgeon who seems invincible in his field, or the humble nurse whose quiet strength and integrity shine through? Let's analyze a few elements that make this story so captivating. First, the story plays with expectations. We initially assume that Dr. Langford's surgical expertise makes him untouchable. However, the story challenges this perception by shifting the narrative to a place where a seemingly powerless nurse becomes the agent of change. This unexpected twist highlights how power dynamics can shift, particularly when they are based on prejudice rather than merit. Second, the use of symbolism is quite effective. The elderly black patient symbolizes more than just a client. He embodies the historical struggle against racial bias and the resilience of the black community. His transformation from a vulnerable patient to a powerful figure is a symbolic representation of the larger fight for equality and respect. Third, the story dives into the psychology of prejudice and power. Dr. Langford's character is a study in arrogance and unchecked privilege. His behavior reflects the unconscious biases that can pervade even the most prestigious professions. The story doesn't shy away from portraying the ugliness of racism and sexism, but it also explores the subtle forms of prejudice that can manifest in everyday interactions. Fourth, the story builds suspense by slowly revealing the mystery surrounding the patient's identity. This keeps the reader engaged and curious, wondering how this seemingly ordinary patient might hold more influence than they appear. The revelation of his true identity as a powerful judge adds a layer of intrigue and raises the stakes for Dr. Langford's actions. Fifth, the resolution of the story is both satisfying and the downfall of Dr. Langford is not a vengeful punishment, but a consequence of his actions. The introduction of the Brooks Standard as a lasting policy change ensures that real systemic change occurs. It's a reminder that individuals can create lasting change, and that true power lies not in position, but in integrity and empathy. Her path to nursing was shaped by her mother's example, a hard-working hospice nurse in Detroit who juggled 12-hour shifts with unwavering compassion and grit. For Tiana, nursing was more than a career. It was a calling. It was about people, about empathy, and making a difference. This helps our stories reach more people and keep inspiring them. So, shall we dive right into it? We meet our protagonist, Dr. Matthew Langford, a surgeon who carries himself with the kind of arrogance that only a gifted doctor, who is just a little too comfortable with his abilities, can possess. Then the plot thickens. A VIP patient arrives at the hospital and the head nurse entrusts Tiana with the responsibility of caring for him. The patient's identity is shrouded in secrecy, known only to a few, including the hospital administrator. As Tiana walks into room 304, an elderly black man lies in the bed. He acknowledges her with a nod, setting the stage for their interaction. However, The calm is shattered by the dramatic entrance of Dr. Lang, who scoffs at the presence of a junior nurse in what he believes is his domain. He dismisses Tiana, highlighting her lack of experience and implying that she is out of her depth. Then comes that fateful pause. Not a racial slur, but a loaded silence that speaks volumes about the biases of the time. Tiana stands firm, highlighting her qualifications and experience, but Langford remains dismissive. He demands that she leaves, ordering her off the case with no room for argument. Despite the humiliation, Tiana maintains her composure and continues documenting the patient's vitals. But who is this mysterious patient? What is his connection to Tiana and Langford? How will this encounter shape their lives? Now, what's fascinating is how the story flips the narrative of power. Who actually holds the power in this scenario? Now, if you're looking for more stories like this, consider checking out our other content where we also explore similar themes. Now, back to our discussion. A doctor and a nurse were busy in front of a patient, completely unaware that he was a famous Hollywood actor. Good morning, everyone. Welcome to our channel. Today, we'll be telling you a bedazzling story that will make you feel embarrassed for the people involved. So without any further delay, let's begin. There was a doctor and a nurse who worked at a clinic located in Beverly Hills. The clinic was small but well known in the area for its great service and staff. The actor went into the examination room and sat down on the bed. A nurse entered the room to measure his blood pressure and ask him some preliminary questions. After the checkup, the doctor came in. She greeted the patient with a warm smile and introduced herself. But he just stared at her, completely ignoring her greeting. When he returned from the restroom, the doctor finally asked him, "Why aren't you telling us who you are?" The actor was taken aback by the question. As soon as he left, the doctor and the nurse looked at each other in disbelief. They couldn't believe that they had made such a big mistake. The actor, on the other hand, decided to make the best out of the situation. He used his experience to make fun of the doctor and the nurse on a popular talk show. What did you think about the story? Let us know in the comments below. We hope you enjoyed the video. Don't forget to subscribe to